The discussion about vaccinating your children has reached Capitol Hill, but 22 News I-Team reporter Ryan Walsh discovered it can really hit home in your child's classroom.
Diseases that were once thought to be eliminated are surging again, making kids sick and in some cases taking their lives way too soon. Vaccines nearly wiped out measles and severely lowered the number of cases of pertussis, known as the whooping cough. Now both diseases are making a comeback as some parents choose not to vaccinate their children. Catherine Riffenberg of Chicopee lost her son Brady to pertussis in 2012. He was 2 months old.
We don't know where he contracted it. He was too young for his vaccines. It was Christmas time. It was around the 23rd of December. You know, we have children holiday parties, we have Christmas concerts, visit with Santa, so we don't know where he contracted it.
The 22 News I-Team discovered more than 1,000 kindergarten students in Massachusetts have either medical or religious exemptions and don't have to be vaccinated to attend public school. That number has nearly doubled in the past decade. To get a religious exemption, you don't need any proof, just a signed letter from a parent. There were more than 800 religious exemptions in Massachusetts last school year.
We're not here to doubt the parents. If the parents come in and say they have a religious exemption, we have them sign the form.
In Hampden County, more than 1% of kindergartners have vaccination exemptions. 3.6% have exemptions in Berkshire County, 3.9% in Hampshire, and a state-high 5.5% of Franklin County kindergarten students have vaccination exemptions. Is there any science that supports not vaccinating?
Most physicians would say that there is not a strict science to support any of that. A lot of parents who choose to change their vaccination schedule for their child can cite different studies that are out there. I think a little bit it's one of those, there's so much research going on nowadays that if you look for research on a particular topic, you will find it.
According to the CDC, there were more than 640 measles cases nationwide in 2014, including one at Bay State Medical Center that exposed 300 patients to the disease in just a matter of minutes.
It's highly contagious. It only requires a couple minutes of exposure for that, and so it's a casual exposure too. So you just need to be in that same room.
Pertussis is another disease that can be immunized against. In the spring of 2013, there was a pertussis outbreak at Northampton High School. More than 50 kids got sick. We haven't seen this many pertussis cases since the 1950s. What would you tell other moms?
It's important to vaccinate. It's important to make sure people around them are vaccinated. Keep that protection around them. Herd immunity is very important. We don't understand how important it is. And now with all these outbreaks, we're starting to see it's starting to come more to light how important vaccines are.
Dr. Rourke told the I-Team it is important to give parents a choice, but for many children who medically can't have vaccinations, that herd immunity is imperative. To see an interactive map of how many students have vaccination exemptions and how many students are vaccinated for each disease broken down by school, go to WWLP.com. I'm Ryan Walsh working for you with the 22 News I-Team.